Hello, welcome to You Better Ask Somebody. My name is Erica Wood, and this presentation is for you to understand what before and after is before it is too late. And this is something that is going to be awesome. If you cannot read this, please know that there's going to be a slideshow of this presentation. So if you cannot read the screen, you can always go back to the presentation, and then you'll be able to read and direct and see what you need to see other than hearing me speak. So what this is when you want answers, get them or find them or someone else who will, and they will do more. So I'm going to start this presentation. I was saying good day to you all. I will start this presentation for what it is. It's the first question that is asked is, well, what is this presentation? Just in case you cannot see, it says here, my answer to my reader is, this is not a presentation, this is my present action. My reactions, people's reactions towards this presentation, this present action is going to be negative and positive. So I really don't care what someone thinks about this present action that I am doing today. What I am going to have with my responses is, if this present action is for my fight, this present action and is for those who will fight beside me, and we will fight together because we want answers before and we want answers after. So here you see the reason for this present action. It starts here at the very top. It says victims. This says government, family, corruption, murder, trust, learn, hospitals, and all that comes with it. The lies, the mistrust, the results, the end, the fight, the knowledge, and the acceptance. So this question that we are probably going to be asking is, when, what, where, and who do we ask? These are very important questions because this is something that you're going to be doing throughout the stay of one of your loved ones that are in the hospital when we are dealing with COVID-19. Like this guy here, you're going to ask, well, what happened? So ask questions that you can comprehend and know how to research after, and ask open-ended questions. Where do you ask these questions? If I go out of this camera, I am so sorry, but I'm dealing with what I can work with. So here it says, when you have the doctor or doctors, nurses, as it said in the first one, where it said about it's going to be cut. Anyway. You're going to ask these doctors when you are by yourself. Because the conversation is less intimidating. Your will for answers are more controlling. And there is better understanding of the situation that is at hand. The issues at hand are the most important, and you want to identify what the root of the problem is. So back again, you're going to say when. When did my loved one? Open-ended questions. What caused my loved one? What is being done? What has to be done? How? How did my loved one? With, without, how did it come to this? Who? Who has? Who made the decision? Who decides? And who are you, please? What? What can be done? What has been done? What needs to be done? And what could be done? Listen. Listen is the most important thing that you can do at this point. When your loved one is in the hospital, either on a ventilator or not on a ventilator, if they're in the hospital with COVID, it doesn't matter. This is the most important thing that you can do is you listen. You listen and take all the information you can because everything is important at this point. Research. show you how you have listened by now preparing and educating yourself. Get the medications, amount of, and the duration your loved one is on. Record vital signs, past and present. The diagnosis, the status and progress and or failures of all organs. You want to know blood. You want to ask as many questions that you want, because you are going to go and get the answers yourself, and you are going to listen to their responses, and of course, but now it is up to you to do the studies and get the right answers. You need to know what is right and do not believe what is told to you as soon as they tell you that this is what's happening. As they say, don't believe the hype. And if you give me 1 second, I'm going to pause this real quick because I have to put this a little bit more in focus. Excuse me. And welcome back. And I believe I left off when we were talking about getting the answers for yourself. It is up to you. And do not believe that it is for what it is. Your loved one depends on you. My loved one would have definitely be on one. Why? Is the next question that you're going to ask. Why was this done? Why didn't this get done? Why do this when this could do that? Why? It's a very good opening question. Why? A little help to know what to research from the beginning to the end. So you're going to be researching this from when you first walk into the hospital with your loved one, and you're going to be researching this to the end until they're healthy and happy and out the hospital and back home into your loving care. So you want to look at prescribed medications. This is a biggie. This is number one. You want to know, A, what is it for? Is it an anesthetic? Is it for glucose? Is it, for blood pressure medications? What is the medication for? You want to know what the dosage is. You want to know how much of the intake. You want to know the side effects. You want to know what can or will it cause. Will it cause hypertension? Will it cause hyper or hypotension, cardiovascular issues? D, you want to know clinical pharmacology or excuse me, that's going to be edited. Pharmacodynamics. Does it absorb? What the medication action is? What does this medication do to your loved one as they lay there? You want to know, does it have a bio or a chemical effect? Very important. You want to know the duration of the therapy. How long does the drug have to be administered? How much of the drug is the dosage, but also how long? Indications. You want to know, what is the drug supposed to do? Is it supposed to raise your blood pressure? Is it lowering your blood pressure? Is it going to increase your blood, your red blood count cells, or is it going to lower your white blood count cells? You want to know high risk factors. As this medication being used, let me stand up again. You want to know the high risks that are involved. Will they cause a cardiac arrest? Please. Hygiene and care. Are your loved ones being cared for? Are they properly bathed to the fullest of capabilities and access? Ask yourself, if tables were reversed, is this how the staff would want me and my team to take care of their loved one? Very important. There is a time and a place for everything. We all know that saying. Well, unfortunately, in these situations, time has more value than place. If I reacted then from what I know now, what a glorious difference this predicament would have, and you probably wouldn't be seeing this present action that I'm doing right now. So read on carefully, and please read on strong. For this could be your situation sooner or later. The deaths and tears have not stopped, and by all means, I never thought that I would actually be sitting here with one of my loved ones that had died from COVID. Let the growing grow tough. Many tears have shed over the loss of a loved one due to COVID-19. The hard part is different amongst each individual whom has suffered from losing someone due to this horrible and highly contagious virus. Opinions are everywhere on just about everything and anything. Mask, you get your mask, you have the vaccines. There are more. We're going to edit that too. Don't you worry. I'm going to pause. Okay, we are back, and I apologize, but it was edited, so you won't even see it. I got to stand over here because I'm getting a glare on my face. So here, like I said, we left off where I was talking about opinions are everywhere, just about everything, anything, the vaccines, the mask. But here, there's more questions than what we have with answers. So here, as far as for me, I've always had my opinions and mindset of how we live today. Only did all that change as I sat and I listened to what all families, my family members and doctors, and there was a rude nurse who would just talk right over the doctor. Ice Cube with that face. What the fuck was that? Be a good listener at all times. It pays off. Remdesivir. So now we are going to get more into talking about the medications that concerns me the most. According to Gilead, Velcade, also known as Remdesivir, is a SARS-CoV-2 nucleotide analog RNA polymerase inhibitor for the ages of 12 and older. Make sure you're listening and you're paying attention. The dosage and administration states that in all patients before initiating and during the treatment of Velcade as clinically appropriate to perform renal and hepatic laboratory testing and access proton time. Proton time is the one way of measuring how long it takes for blood to form a clot. It is it's measured in seconds. And this here, when I have these, this is going to be my resources. So if you want to go and check it out and make sure that I'm saying what I'm saying is legit, help yourself. Know your information. They will know if you don't. They prey on the weak and they prey on the ignorance. For patients not requiring invasive mechanical ventilation and or ECMO, the recommended total treatment duration is 5 days. If a patient does not demonstrate clinical improvement, treatment may be extended for up to 5 additional days for total treatment duration of 10 days. For patients requiring invasive mechanical ventilation and or ECMO, the recommended total treatment duration is 10 days. Administered Velcade via intravenous, which is a blood infusion, an IV, over 30 to 120 minutes. Renal impairment, Velcade is not recommended in patients with an EGFR less than 30 milliliters. Again, that is my resources. If you do not believe me, go and look it up yourself. A little help to know what to look for. Let me move the chair out of the way so that you can see my little happy face, because he's questioning some shit. More recent studies have shown that Velcade was made for patients of the age of 12 and 18. Remember, I told you to pay attention. Remember, learn, and listen. And with an EGFR estimated glomerular filtration in kidneys of no less than 50, but FDA recommended no less than 30 due to lack of data. Recent studies also explain that putting a patient on Velcade for a duration of 5 to 10 days begins the process of organs to shut down to complete failure. And that the duration of therapy should continue to discharge or when the patient starts to react to positive outcomes, whichever one comes first. Warnings and precautions include hypersensitivity, including infusion-related and anaphylactic reaction, increased risk of transaminase elevation. December 31st of 2021. I knew my loved one had been in the hospital. She's been fighting COVID for some weeks now. I heard how there was no ventilators or there was any harsh medications. There was no problems about her organs shutting down, just on oxygen, and that was increasing slowly but surely. I joke with my loved one by sending a text this day saying, "Get the hell out of the hospital bed. It's been too long. You've been sitting doing nothing at all." I did not get a cuss word back. Days later, still nothing back. Here it says, this is where I should have paid attention. This is where I should have reacted. If I knew then what I knew now, or what I know now, well, I guess it would be past tense. Knowing that for 3 weeks, my loved one was a COVID patient in the hospital, laughing and awake, talking, planning, over the phone, FaceTiming, and was doing okay. Low oxygen, but was rising slowly but surely. No visitors, of course. Can't have COVID patients, have no visitors, no family. They're there alone by themselves. But there was one who I will call the trooper of the family. Homemade food, whatever needed to find out now that the couple are now both bound in the hospital, which is meaning my loved one and her loved one was now both in the hospital fighting with COVID. Out of the blue, Jack out of the box is what we'll call that one. There were talks amongst the family about and oxygen dropped, or that it wouldn't go past a certain goal that the hospital wanted it to go to. There was no communications with the trooper. There was no communications with the daughter. No one could get any information regarding anything. Only one able to know what was going on was lying next to my brave, strong loved one. January 1st, 2022. I didn't expect to get any answers from the nurses, doctors, etc. From anyone that all hospitals are made of. Remember, listen, learn. I just asked the person on the other end of that phone, what was the nature of the floor you work on, and what does it consist of? Her answer to me was, she works on the medical intensive care unit, and they care for the most critical patients on mechanical ventilators. That was the end of our conversation, and my family and I finally got the answers that we were looking for. Our loved one was put on a ventilator. Why, when, what? Now is the time to think of the research done. 2 days, no words to the whole family. That's 2 days of not knowing what was done, caused, or stopped. Okay. January 6th and 7th. After the phone call, only one sibling was able to communicate with the hospital. We learned that pneumonia was now an issue. No one spoke to our loved one. And out of the blue, the Jack in the Box. See, you listen, you remember I said we're going to call that out of the blue Jack in the Box. A sibling of ours calls, and the family, they're now letting our family to see my loved one, visitors 2 at a time. Or it was two a day. The nurse wasn't very clear. The nurse was very unclear of which one, because she didn't know if it was 2 at a time or 2 a day. So here we are figuring out who was going to go in twos. The first pair went, and it wasn't a happy reunion. I felt something wrong because I knew that something was wrong. It was all to say goodbye to our loved one. The visitation went from 2 to multiple in a matter of hours. January 7th, 2022. Here you say you have your doubt, you have your confidence. The drive took 50 minutes for us to get to the Altman Hospital. The most quiet my family has ever been, especially for how many we shoved in the car. We are a big family, and a big family showed up. We arrived around 2 a.m. I have never seen a person on a ventilator in my life. Never once have I ever seen anyone in a ventilator on their stomach. That's how I found my brave loved one. So there goes from the beginning, the lies, corruption, hurt, and the pain. The lies and the truth. So this is when you sit back and you listen. You will have your turn. Just don't let it be too late. You'll never walk alone. Justify or just understand. In the beginning of my present action, I mentioned that intimidation was a source of negative reactions and responses. The interactions between the hospital staff and my family were blind confusion and disbelief, anger and frustration amongst us all. But we never forgot why we were there. COVID. Some didn't cope well after hearing what was being said amongst the family. Excuse me. It's going to get a little emotional now, but it's okay. Because amongst the family to the hospital staff, vice versa, there was arguing and demands being made. Questions would have answered. Answers were have answered. Okay. This is what I consider lies and betrayal. We were told by doctors and nurses that our loved one is currently suffering kidney and complete lung failure, that all organs were shutting down, and the outcome will be very soon. 6 a.m., 7, 8, 9, then by 10 a.m., there was no validation of consistency amongst the several residents, the residential doctors and doctors. The hours 11 through 5 p.m. Excuse me. The artist painting the masterpiece of total destruction. There was nothing but bad ways of handling situations from both sides of our family, and by 6 p.m., frustration was so much that most of my family began to leave. Talk to them as if you're one of them. Then hit them hard because you know that you are better than them. Remember to ask questions and then show that you were listening. So I pulled the doctor that was in the room, explaining my loved one's bad and fading condition. I explained that I waited for everyone to leave so that I could elaborate on what I had heard today. That what I had to say, if said with them being there, I would have been lashed at as well because some would not like what I have to say. So I asked if she didn't mind if I took a little bit more of her time. Just remember, stay just as calm, cool, and collected because we are now one of them. I told her that what happened today was bad on both parts, family and healthcare providers. As family, we have not dealt with the law so close, nor have we seen or worked as a COVID health provider as they have for these past 2 years. My family have read, absorbed, listened, and watched TV. It's hardly a means to say that they are educated themselves to know what these nurses and doctors go through every day. With that being said, as far as them, I told the doctor that there is no way that we were going to take what they say and the other doctors say, which was never the same diagnosis. Nothing said between the doctors and nurses collaborating except that our loved one was dying. Go ahead. Now you are better and you do not give up. So here's the part when after you heard all the demands and unanswered questions, you do your research. The doctor agreed to my demands, which was to give my loved one vitamin C and some zinc. A little bit of background about me. My name is Erica Wood. I am 41 years old. I have 5 children, ages between the ages of 8 and 23. I have a bachelor's degree in criminal justice. I have a political science and a anthropology minor pathology. I worked for Summit County Medical Examiner's Office and was an apprentice for 7 years. Instead of saving lives, I worked with those that they could not save or it was too late. Mm. This makes nothing. It does not make me any better, but it means that my loved one would be closer to coming home, and I probably wouldn't be writing this present action now. When you do not question, you get no answers. Mm. How many died not knowing that their loved one did not have to walk alone? How many more have to die before we look at this government and do in the world we live in? And I do not walk alone. Here is my references, last page, and I will see you part 2. All right, welcome back to part 2. I guess it did get a little dark in here for me, but that's okay because now this is where you better ask somebody and that you will never walk alone. So here you're going to test your listening skills. Rule of thumb, repeat back what they said in their own words. Let them know you were listening. January 7th, birthday surprise for us all. Not only was the family called out to say our goodbyes, we were also saying happy birthday to not one, but 2 strong loves of our lives. Remember that trooper who did all she could to help the stay in the hospital more pleasant and comfortable for the 2 that was in there? Yes, these 2 were born on the same day but a different year. Could you imagine? Attack mode. Let me say that again. Attack mode. While talking to my family about the agreement the doctor and I had about trying vitamin C and zinc, the whole death is imminent was looking more and more like, holy shit, we have a fight around our hands. Educating yourself can be more time concerning in some circumstances, but it's never too late to always keep learning. Vital signs started to rise, not fluctuate. Example, the average to normal blood pressure is 120/80. Heart rate of 60/100. When we got to the hospital, we saw vital signs of 75 over 43, heart rate 1990. After the injection of vitamin C and zinc, vitals stabilized 120 over 75 with a heart rate of 65 of 80. I warned the doctors that our darling strong loved one is a fighter and will surprise you. That is exactly what I said to my loved one, who was showing that not only was we being heard, that our loved one was fighting. I warned them. I told them that she was going to do that. My mother went to the bedside, said something that was only meant for the two of them. I never asked her what she said, but I said, Mom, her vital signs went up more. Talk to your loved ones. Tell them that they are fighting. Tell them, because they can hear you. Comfort and support is needed during times like these, yes. Repeat what they say. Listen, learn. I asked the other doctor that was delivering the blow earlier that morning about the lung failure and what would happen if the sudden turnaround kept improving. His response to me now was, the lungs are not at complete failure. We have maxed out the medication to keep the kidneys from failing. Kidney dialysis is crucial at this point, but we need to flip her over from their backside to start the dialysis, and then the back onto her stomach. This will drop her heart rate and blood pressure fast, risking death. If the heart rate stays above 65 and blood pressure steady and it climbs, the procedures can be done with less risk. If our loved one did not show the improvement, visiting hours would have been 24 hours. But the hospital only counts on their patients to pass within an hour. So we had to take our 50-minute journey back home and pray for the best, because she was fighting. In that home time or downtime that you have, study and call every hour on the hour. Record your conversations with the answering party. Tag team the calls with other family members, because I guarantee you, you will not get the same information. That is why you record. The good news to all this, on the birthday of our beloved strong loved ones, her blood pressure kept climbing and her heart rate stayed at 70 over 90, 70-90. Everyone was kept informed throughout the night, and they slept well, knowing that once again, our loved one showed the signs of fight and was knowing that she was not alone. Stay alert, aware, objective to both the positive and the negative. They are both high possibilities with both high emotions. We got our loved one to the point that speaking for herself was not an option. Remember what you learned. Listen. They said when a white coat came into the room, our loved one would start hyperventilating. Remember what we learned. Causing blood pressure to go up. So sedation was crucial to prevent cardiac arrest and to help the body heal in a paralyzed state. I highly doubt a white coat horrified my loved one in any way. I'm going to sit down so I can tell you this one. Seeing the job that my loved one had, it wasn't a white coat that made her nervous. My loved one was trying and saying, they are trying to kill me. A fighter like that knows their body. They weaken the soul to the point to where there will be no more pointing fingers. January 2022. Back to Belcurry, Resmavir. Remember, listen, learn. Not only did the most current studies state that hypertension was one of the side effects, the shutting down the kidneys was the most dangerous side effect. Let's count down the days, shall we? The first day, that the whole family stopped hearing from our loved one and from the hospital was New Year's Eve and day. That is 6 days of no contact. On the 6th, 2 family members went to visit. Our strong, independent love was completely sedated and already in prone position. Prone means lying on their stomach. On the 7th, we were told that her lungs have failed. Then they were not. And her kidneys were failing. When I asked the doctor, did they prescribe Rismavir? She said yes, but it was no longer being used. I asked to see the x-rays, and I asked for the medical chart. I apologize, I do not have the physical evidence now, but I will work on that for a later date. In the records, it showed that Rismavir was treated for 6 days, and the EGFR was at 18. Part 1, I explained how the EGFR calculates in the estimated filtration of the kidneys, and the Rismavir shuts down your kidneys. If not if it's not used properly, Rismavir is now, if not used properly. Let me rephrase that, because I feel like I'm confusing everybody. The EGFR was at 18. Part 1 explained how EGFR calculates an estimated filtration of the kidneys, and Rismavir shuts down the kidneys if not treated properly. Rismavir is now considered an illegal drug that is under investigation. Again, here at this very little print right here, that is my resources. Check it out. Ivermectin and hydrochloroquine. As said in the beginning of this present action, there are so many opinions around dealing with these depressing viruses, and to get vaccinated, don't get the vaccine. Ivermectin works, it doesn't. And hydrochloroquine, oh, it's Trump, oh, it's not a solution for COVID. It is. The rumors and bullshit goes on and on. The more that I looked into these 2 drugs, the more I understood that by what I said in part 1, if hospitals look at their patients as if they're already dead anyway, what is the risk of trying what clearly is listed on every resource I read? None of these drugs carry weight that they are or are not effective. I do not see what these hospitals will do. I don't see these hospitals trying to preserve life. I do see that they're trying to kill it. After seeing the increase of vital signs of my loved one with the vitamin C and zinc, they did nothing to the other patients lying on their stomachs or lying on their backs like they didn't want to see another one, somebody having a fighting chance. My brother spoke very highly to about these 2 medications with another family that was dealing with the same battle. Hopefully, after this present action, you will see I'm not walking alone. Nurses, practitioners, and lawyers joined our cause to fight these murderous, fucked up people that call themselves doctors and nurses. They save lives. I see that as bullshit. January 12, 2022. Let them know how good they are doing. You give them their vital signs and you tell them that they are fighting. Promise you. I saw her fighting back when I was talking to her. Okay. So here, okay, well, like I said, you'll have the presentation, all the screens without me talking, so hopefully you'll go back and you will read this. So here is a picture. The every hour on the hour calls never stops until your loved one comes home. As said in part 1, there is always something different said and always important to listen. I learned from Dr. Ling, who was the late night doctor on site, that it is only the morning doctors who changes anything concerning meds and dialysis, etc. The night doctors are only there for emergencies, and they do not intervene with the changing or adding any medications. I explained how the vitamins increase and her vitals increase and how they remain stable. I asked if she would recommend upping the dose of the vitamin C and the zinc. She told me to speak with the morning doctors because they found some validity to my request to do what they did for me. I asked if she would give me access to see my loved one's current x-rays and medication given in the last 48 hours. She did exactly that so that I could tell my family what we were up against and facing as one. If a little more of zinc and vitamin C was an option, I had to talk with the morning doctors face to face. At 2 a.m., my brother and my best friend and my fiance and me went, okay, that was too loud, me, eyes, and run-on sentences, went to stay at a hotel 8 minutes away so that I could be there in the flesh to speak with these doctors. When we arrived at the hospital at 7 in the morning, Dr. Lynn kept her word. My love was on 4 drips now. The first x-rays I saw was similar to this example. Again, resources. You can check them out. This is what her chest looked like. This here is what it looks like when you have the pneumonia. So there was no denying that she had a lot of inflammation going on in her chest. Their lies, their fight. Levophed is a BP medication, a blood pressure medication that is given until the patient comes off or the family takes off along with the ventilators. So here I'm going to explain when I said my sister was back on 4 drips. A 4-drip IV is a bit much, and that for my readers, my loved one was using 4. It is very true that with 4 drips, you are looking entirely at the medication doing the work, keeping the blood pressure going. It is not your loved one using their own will to fight back. The hospital pulled back and went to 2 drips. No denying that our loved one was fighting back. 2 whole days, my friends. Every hour on the hour calls, and I was being told that blood pressure had dropped and that they had to start back up to 3 drips. They had to add small doses of insulin. The glucose water caused a spike in her sugar. 1 second, because I believe that was important. If you can go back on that one. I'm doing it. Let me see. What? I can edit it. Okay. I can edit it. All right, so always stay objective and keep both positive and negative in focus of your attention. This is an example of what an x-ray looked like the very next day. Now this here is nothing but a buildup of scar tissue around her chest, her lungs, all her organs, her kidneys. The thick mass is scar tissue. This is irreversible. The light cloud of the smoke is the infection. So that's going to be like this in here. But this is all scar tissue. Zinc and vitamin C helps heal and builds the immune system. January 12th, 2022. I mentioned that I never saw a patient on a ventilator lying on their stomach. The problem we kept running into was that the dialysis for kidneys was a must, and turning to her backside would cause immediate slip in blood pressure and heart rate. When the doctors arrived to explain the condition, I was told that they will now try to flip because even though it is risky, what else could we do? What could we lose? Yes, I'm breathing very hard. But I knew that if we did not succeed in getting this dialysis as soon as possible, I had to be objective and both positive and negative. It is about 8 a.m. and I went to make phone calls and to ask the only one who could give permission to flip. In less than 5 minutes that I got back to that room to say, let's do it, my strong, loving, willing to bleed for all had went from 117 over 70, from a heart rate of 87 to 73/36 to 61. I could not believe that this hospital had nothing to do with the cause of the sudden drop. I knew that as far as my sister's life, the fight she fought so well and hard, like I knew that she would have, was over. After I called the family to let them know that it was not the hospital calling them this time, it was me. The realization hit me then. So I went into her room, I bathed, lotion, what I could do so she would be clean when our family arrived, and I held her and I cried with her and we laughed. I asked the nurse, why was her head not being rotated from right to left, which is done every 6 to 8 hours? Another fucked up. Read part 3. I have been there for 10 hours and she never changed positions. She said because the last time they tried, her blood pressure had dropped more and that they couldn't do it anymore. The reasons they give, but only if you do not ask questions. Go find your own answers. Just don't do the right thing too late. After my strong, beautiful sister passed, I realized so much that I can't cope and be strong all the time. My sister has so much of integrity, strength, and dignity. She loved hard and will go to battle with you. Arguments and the, I'm so sorry. To her crazy, just like her mother, my sister's pride and joy daughter, my niece. I got you, and you are just like your mom. My sister showed me that anything you want is yours. She didn't have to say one word. She showed it. Whatever my sister wanted, she earned it, and she had it. Now my family and I are planning her funeral. Today, it is January 19th. I started this present action yesterday morning at 8 a.m. It is hard to know what I know now, clear as day. No questions, no doubts. None of that. I'm just grieving, and that hurt. To Altman Hospital in Canton, Ohio. This is directly towards you. You bitches murdered my sister. Next, please. This here is far, far from over. To whom this may concerns. You have killed so many people these past 2 years, and you will continue to do so. With a shrug of my shoulders. You will continue to let these hospitals and your drugs and your precious need for control. You will continue to corrupt the system and try to define and destroy the rights of the people. That not only do you show you do not have a conscience, but you also show that you don't give a goddamn care about your own. And I'm sorry, I said your fucking own. It has been the same since you shit started to believe that you can take over the world. You are too fucking stupid and becoming so weak to realize that all the nations and races are kicking your ass at your own fucking game and in your own fucking country. You can't kill us all. You better do us all at once. Because we are the majority. We are the people we recognize you. We the people are pissed and we are fighting back. Altman Hospital, this is directed towards you. If you think that my sister's death was just another paycheck and will not be noticed, did you see this coming? You made my strong sister a martyr. I thank you. Now just wait for part 3. We are going to free half you fucking slaves by the time we are done, because I believe a lot of you don't want to kill people, but you're doing it for a paycheck. So, you're welcome. Never walk alone. Now please read the fine print. Don't thank me yet. The storm is coming.